This is Ty Newell with COVID status report number 19. And this topic is summer surge, a 5 alarm fire posted as of June 29th, 2020. Now, a number of you who know me have been saying they appreciate getting these updates, but also that it leaves them quite depressed. And so this week, I'm going to try to bring you more depressing news, but in an uplifting manner. So 2 weeks ago, where were we? I made this plot and I said to Deb, this is pretty depressing because the gray line is the line that I think we're going to follow. That's where the infection parameter was heading. That's where our social distancing and transmission efficiency had moved to. But the data was not quite there yet. It was at a place where hopefully it could follow the yellow path, which I think we could still move toward. But realistically, it looked like we were headed to the gray one. Last week, when we updated this report, I added the week's data to it. And sure enough, it's heading in a bad direction. And now updating it again with this week's data in terms of new infections per day for the United States, it's a 5 alarm fire. And by that, I don't mean panic. I don't mean stick your head in the ground. I mean, let's take action. It's up to us. Our government has failed. The Secretary of Health and Human Services on a morning news show was stating how he felt we were not going to be successful. And so I take that to mean, okay, get out of our way. We're going to take over and get this thing put in place. When you step back, the trend that we're currently on, 40,000 infections a day that we've currently passed, a new record in the US for infections, is going to seem like nothing because within 1 month, without drastic change in our actions, we're going to hit 400,000 infections per day. So the Secretary of Health and Human Services, or as I would call him, Secretary for the Healthy and Wealthy, he was touting how the government had come up with 500,000 doses of a important medication. Well, 400,000 infections per day, that ain't going to go too far. Thank you, but no thanks. We need to take care of this ourselves. So the summer surge, why is it occurring? We talked a little bit about it last time, but it's heading north. It is not stopping. In the spring, we had a surge up north, New York, Michigan, Illinois, Massachusetts, Connecticut. We were fighting the fight while folks in southern states were cruising along. Up north, we were still huddled in our homes and buildings, keeping warm because it was cold, while down south, spring was coming. Doors were open, windows were open, people were outside golfing and having fun. Now, as heat waves moved into the south during June, while the north enjoyed nice weather where we could be outside, the opposite's taken place. People down south have shut themselves in their homes. They have insufficient ventilation, like almost all buildings throughout North America. And that allowed the virus to take root. It is an airborne disease. That means it is airborne. The governor of New York finally got the message as he announced today that malls cannot open without air conditioning systems that filter coronavirus. That is what we talked about more than a month ago. That is what we talked about more than 2 months ago as this series started. You need fresh air, lots of it. You need to filter the air. And then you should think about adding ultraviolet to kill the germs that are in the air. Summer heat and humidity are moving north, and we're going to see this wave as we update our state outlook moving up to us. It's already showing up. The 1918 pandemic, there was no air conditioning. Every window, every door was open. People slept outside. They slept on their front porches, on their sleeping porches. They had maximum ventilation. The contagion was not allowed to concentrate because it's cooler outside at night than it is in a building without air conditioning. So let's look at the changes. These plots I showed 2 weeks ago, and I have not changed the lines on these plots. And so you can see how the changes in the infection parameter, the parameter I've defined that roughly says for each infectious person, how many others will be infected over a 2-week infectious period. And that parameter, when it is above 2.72, a mathematical boundary, but a very strict boundary that when you're above 2.72, infection cases will grow, they will accelerate day by day. And when you're below 2.2, they will decrease. The number of recoveries will outpace the number of new infections until it dies away. And as we looked at the southern wave from California through Arizona, Texas, Florida, and the Southeast, we saw that California, which has never gotten below 2.72, has always had a growth in infections and continues to today. And they've since 2 weeks ago taken a further jump, further accelerating the rate of infections per day. They need to get it in control. North Carolina is still above an infection parameter of 2.72, but they are somewhat level, but struggling to try to get below that boundary. Florida, it's just taken off. It's hot, it's humid, it's going up and out of control. And I hope that they can get this figured out. But it's a tough climate to do that in with a virus that's showing no sensitivity to the outdoor weather. New York, I had projected 2 weeks ago, based on the infection parameter trends, that somewhere in August, they were trending toward enough backsliding and laxing of restrictions that they were going to be accelerating again. I was hoping it would have been a slow enough progression following that line that they would have detected that and then taken action against it. But as you can see, New York is accelerating their movement toward and crossing over the 2.72 boundary. And so they are seeing growing infections per day. I do hope that they can get it back down below that, but for the time being, it doesn't look good. And I attribute part of this growth above the projected line to be due to warmer, more humid weather moving into New York and causing more people to move indoors with insufficient, inadequate ventilation and filtration. Georgia, similar to Florida, has taken a jump up. It's hot, it's humid, it's sticky, it's not pleasant outside. People are going inside and they're paying a price for it. And Washington, they don't, Seattle has about the least amount of air conditioning of any region in the US. And so it's not so much of a summer surge there. I think it's just been a struggle to manage the disease as it is everywhere. It's really tough. Ohio and Minnesota, they were fairly level about 2 weeks ago, and I was hoping they could keep below the 2.72 line. But as you can see, over the past week to 2 weeks, they've jumped up. Ohio more than Minnesota. And again, I attribute this to the heat wave moving north. We are now getting into hot, humid conditions in the Midwest and the northern states of the US. Ohio is warmer than Minnesota, so Minnesota's lagging a bit, but they're on their way as well. And then Illinois and Michigan, which had been worked hard to get this in control, have been trending down, but again have jumped up without noticeable changes in their social distancing index. But the transmission efficiency has jumped up. And I feel in both states, as I know directly in Illinois, people are going inside more, shutting themselves, sealing themselves in air conditioned buildings. You need more fresh air than what you're getting. You need more filtration, and you need to see if you can add ultraviolet to help kill the viral particles. There is time to reverse. So this is the uplifting part. We're not that far away. Our infection parameter is about 4. Where we were earlier in the spring as this thing started getting hold was a level that was greater than 10. So 4 infections per infected person over a 2-week period is still larger than 2.72. It's in an area where infections are growing daily, and it's going to take us to 400,000 infections per day within 1 month. But it's fairly close to 2.72. If we social distance more, and we had been at a social distance index of about 60. New York had reached about 70 to 75. If we, as on average in the US, increase social distance from 30 to 40, as well as work to get the transmission efficiency from the current level of about 0.2, 0.22 to about 0.1, and this efficiency is relative to the transmission efficiency before we started taking action like masks and remote work and altered schedules. So we were at a transmission efficiency of 1, and relative to that, we have done well. We've cut it down to about a fifth of that, but we need to cut it more. And this means also added in will be more fresh air, air filtration, air sanitation, and in addition, as we mentioned, one cheater, one unmasker can damage and undo the hard work of 20 who are socially isolating properly and wearing masks in public. One person out of 20 can infect more than enough people over their 2-week infectious period to cause the infection parameter to rise well above 2.72. 5% of the populace that are cheating on isolation, that think they're better than these rules, that think they should be free to infect others willy-nilly, free to not wear a mask because of this amendment or that amendment, just takes 1 out of 20 to screw us all. So get that word out. Hopefully let others know in a nice, gentle manner. And when they seem resistive, don't get in a fight. Just shun them. Okay, like we used to do in the old days. Extensive testing, tracking, and isolation, despite what the Secretary for the Healthy and Wealthy says, who says he doesn't believe it's effective or it can't work now. It absolutely works. It's necessary. We need to get this program underway everywhere. And then act like it's 1918. Increase ventilation as much as possible. I know it's hot and humid out, but you've got to get CO2 levels low, which also indicates a lowering of the concentration of contagions, somewhere below 800 parts per million. Open doors, windows, go outside. The more time you spend outside, the less contagion that will build up inside. So if you're infected, get out of the house. Don't go in a building. Stay outside. And don't gather outside or inside. I'd recommend, if you can, turn off your air conditioning. See what it felt like in 1918 to live in your house without air conditioning, and figure out how to stay as cool as possible. And I'll guarantee you that means you're going to open up every damn window and door in your house. You're probably going to sleep out on the porch. Use a box fan like we did in the old days to blow air in large amounts through the house. Heat and humidity are hard on old people like me. Heat stress is deadly too. When heat waves move across the US or across Europe, hundreds of people die. A lot of our longevity, a lot of our increase in aging is due to more comfortable buildings, due to air conditioning, due to comfortable heating systems that didn't exist in 1918. So it's a double-edged sword. We developed these, but in the overabundance of enthusiasm to save energy, we sealed ourselves into buildings and have made ourselves sicker. That's why asthma has more than doubled. That's why allergies have rapidly increased. That's why we're not as healthy as we used to be. We don't get as much fresh air as we should. Now, I've written a paper that pairs with this talk called 400,000 Infections Per Day. It's a call to arms. It lays out the things that we're discussing in this talk, but in, say, a less ranting manner. And if you would like a copy of it, I can send you a PDF of that. Just send it to my email address, tynewell@illinois.edu. And it should be a fairly respectable looking paper that you can send on to others without too much embarrassment. So I'm sorry to sound like a broken record, but it's just over and over. It's like Groundhog Day. When are we going to get serious? I just don't see anyone else saying, hey, we're going to hit 400,000 infections a day. But we are. That's where we're headed. And we can stop this. We can stop it now. We don't have to be a bunch of lemmings. We don't have to act as if we're participants in some gruesome reality show. We can stop this. And the sooner we do, the sooner it will stop. Serious isolation, perfect isolation, kills this thing in 3 weeks. Less than serious, but still reasonable, will help us get down to a manageable number of infections by the fall so that we can withstand a fall wave. But where we're headed now, it's certain disaster. So, and this 25 million infections in the fall with 400,000 infections per day on our current path, this will look like nothing as we're barreling along toward ultimately about 200 million infections in the US. Stay away from unmaskers in public, simple guidelines, get fresh air down below, have enough fresh air to get indoor air quality where it's less than 800 parts per million of CO2, increase filtration greater than MERV 11, MERV 13, MERV 16. MERV 16 is equivalent to a HEPA filter, in case you're confused on the two. And then implement ultraviolet germicidal irradiation. It is effective. It helps. It doesn't take a lot of power. Continue to mask, stay distance, and I fear for our essential workers and medical staff. Thank you for being there. We got some tough times ahead of us.